Heart attack is one of the most common nowadays. There are many reasons for heart attacks. In fact, there are more than 500 types of heart attacks. But in this video, we are going to discuss about the 3 common causes of heart attacks. So if you want to know what are the 3 common causes of heart attacks, watch this video till the end. And also share this video with your family and friends because it might help them. Common symptoms of heart attack are chest pain, discomfort, shortness of breath, nausea, sweating, and lightheadedness. Also, some people don't show any symptoms at all. And by the time they come to know about their heart attack, it is too late. That's why it is very important to know about the causes of heart attack. And once you know the cause, you can avoid that and prevent yourself from having a heart attack. First reason for heart attack is high blood pressure. High blood pressure is one of the leading causes of heart attack. In fact, 75% of all heart attacks happen because of high blood pressure. Blood pressure rises when the arteries get narrower. This makes the heart work harder, and over time, it weakens the arteries. High blood pressure can also damage the blood vessels in other parts of the body, such as in the kidneys. When the kidneys get damaged, they leak protein in urine. So if you see protein in urine or you have difficulty in urination, this could be a sign of high blood pressure. High blood pressure doesn't cause any symptoms until it has done some damage. So you should check your blood pressure regularly. Normal blood pressure is considered to be 120 over 80 millimeters of mercury. If your blood pressure is more than 140 over 90 millimeters of mercury, then it is called hypertension. If your blood pressure is very high, then you should immediately consult your doctor. Second reason for heart attack is coronary artery disease. Coronary artery disease is another leading cause of heart attacks. In coronary artery disease, the arteries which supply blood to the heart get narrowed. This happens because of the deposition of fat, cholesterol, and calcium in the arteries. As the arteries become narrower, the supply of oxygen to the heart becomes less. And when the supply of oxygen is less, the heart does not function properly, and this leads to heart attack. The coronary artery disease is caused by diabetes, high blood pressure, and high cholesterol. So, to prevent coronary artery disease, control your diabetes, control your blood pressure, and reduce your cholesterol. You should also avoid smoking and alcohol. You should do regular exercises and eat healthy food. If you do all these things, then you can reduce the risk of coronary artery disease. Common symptoms of coronary artery disease are chest pain, especially when you are doing some physical activity. Other symptoms include shortness of breath, nausea, and lightheadedness. If you experience any of these symptoms, consult your doctor immediately. Third reason for heart attack is atrial fibrillation. Atrial fibrillation means the upper part of the heart is not beating properly. Normally the heart beats in a regular rhythm, but in atrial fibrillation, the rhythm is irregular and the heart beats very fast. This can cause blood clots in the heart. These blood clots can go to the brain and block the arteries in the brain. This will cause stroke. Atrial fibrillation can also cause heart failure. In atrial fibrillation, the heart cannot pump blood properly. Because of this, the blood starts leaking out of the blood vessels and this leads to edema. In this condition, you will have fluid retention, especially in your legs. So if you have swelling in your legs, this could be a sign of atrial fibrillation is caused by high blood pressure, diabetes, coronary artery disease, and sleep apnea. Atrial fibrillation can be treated with medicines such as amiodarone, flecainide, and dronedarone can restore the normal heart rhythm. There are also some side effects of these medicines, so consult your doctor before taking these medicines. Other than medicines, you can also do cardioversion. It is a procedure in which the heart is made to beat in a normal rhythm by passing electric shocks. If your atrial fibrillation is long-term, you may need a pacemaker. Other than these 3 reasons, there are many other causes of heart attack. Let us discuss about them. One of the cause is age. Age is one of the most common factors for heart disease. The risk of heart disease increases as you grow old. The risk increases rapidly after the age of 65. Gender is also an important factor. Men are at higher risk of heart disease as compared to women. But after the age of 55, women are equally at risk. Family history is also an important factor. If someone in your family has had heart disease, then you are at higher risk. You should consult your doctor and ask about the risk of heart disease. Your doctor will tell you, according to your family history. People with diabetes and low vitamin D levels are also at higher risk of heart disease. Also, obesity and lack of physical exercise increase the risk of heart disease. Now let us discuss how we can prevent heart attack. First, stop smoking. Smoking damages the arteries and increases the risk of heart attack. So quit smoking if you want to protect yourself from heart attack. Second, control your blood pressure. High blood pressure is one of the major causes of heart attack. So keep checking your blood pressure regularly. If you have high blood pressure, consult your doctor. Third, reduce your cholesterol. High cholesterol also increases the risk of heart attack, so you should get your cholesterol checked regularly. Fourth, control your diabetes. Diabetes increases the risk of heart attack, so keep your sugar levels under control. Fifth, be physically active. If you are not physically active, then there are more chances of getting heart attack. Do some exercises like walking, jogging, swimming, etc. Sixth, maintain a healthy diet. Eat fruits, vegetables, whole grains, and lean proteins. Reduce the intake of saturated and trans fats. Saturated and trans fats increase the level of bad cholesterol. This increases the risk of heart attack. So avoid these fats. Seventh, limit alcohol intake. Drinking too much alcohol can increase your blood pressure. This raises the risk of heart attack. So drink alcohol in limits. Eighth, maintain a healthy weight. Obesity increases the risk of heart attack, so you should maintain a healthy weight. Ninth, get enough sleep. Sleep deprivation increases the risk of heart attack, so sleep well. And 10th, manage stress. Stress increases the risk of heart attack, so find some ways to manage stress, such as meditation, yoga, deep breathing exercises, etc. In the end, I would just like to say that heart attack is one of the most common diseases nowadays. But you can prevent it by making some changes in your lifestyle. Just follow all the things which I have told you in this video, and I promise you, you will never get heart attack in your life. So, take care, stay healthy.